so Emily, why don't you go ahead?
Yes, yeah, Emily Harris with Every Child Matters.
Yes.
I am the mother to a 6-year-old who has some health complications. And we struggle here in the state of Iowa because she is a Medicaid recipient to keep her with coverage. And this is shaping up to be the healthcare primary. I think a lot of people have said that. And interestingly enough, a lot of people talk at length about their plans for healthcare, but none of those plans are directly about children's healthcare, which they have a very different set of priorities and health needs that need to be met that are different than what adults have to have. So my question for you is, as president, what actions would you take to ensure that all children have health coverage and receive the health services that they need?
I appreciate that. So first of all, let's just broaden the aperture on health. We know that child poverty is violence. It really is. It has traumatizing effect. And when parents, and about half of all children are going to live at some time with a single parent, when parents don't have the economic resources to provide the basics, it actually creates environments where health crises become more of a crisis. So first and foremost, we're going to make sure that every child is born in an economically empowered environment, which means we are going to massively expand the earned income tax credit, more than doubling it, which will lift the salaries and incomes of about 150 million Americans. We're going to expand the child tax credit so that we have almost like a child allowance that will again pull millions out of address poverty for millions of American children. So we're going to try to create more economic stability. My housing plan, as a guy, again, that lives in a low-income neighborhood, I know that a lot of our children's health issues are resulting from substandard or inadequate housing. And so we want to make sure that my housing plan, which makes sure that the rent that parents pay is capped out at 30% of their income, and they have a refundable tax credit. Okay. The next thing I want to say for health, which is really important, a lot of parents have special needs children, and we don't honor that work. To stay home with a special needs child is work. And by the way, if you couldn't do that, that child would have to end up being taken care of somehow. And so when I say I expand the earned income tax credit, we're redefining work as well. That if you're a parent that's taking care of a special needs child or a spouse that has Alzheimer's, if you're staying home to do that, you will qualify for that tax credit and for more resources back into your pocket as well. And then we get to healthcare directly. This is really critical that we have a healthcare system where nobody falls through the cracks. Because if we do, we will pay for it. Right now, America has the most expensive healthcare system on the planet because it is inadequate and it has too many gaps in which people are falling out and often get their healthcare in the hospital emergency room. And that's why I support making sure that every single American family has healthcare as a right. Now, getting there is the challenge. I don't think there's anybody on the Democratic debate stage that doesn't believe every American should have health insurance. We're all together on that. I believe that if we're going to design this system from anew, we would design a single-payer system. The system we have has all kind of irrationalities. But I don't want to sit here and tell you, as your president, that that's what I'm going to do, because Obama wanted to do a lot more. He couldn't get the public option done. He couldn't get into the Obamacare. He couldn't get lowering Medicare eligibility to 55. What I'm going to tell you right now is that every single step of the way of my 8 years in the White House, we are going to make gains on expanding coverage, lowering costs. It starts with addressing issues for my kids in Newark who can't afford parents can't afford to buy an inhaler. For childhood diabetes, which is on the rise, not being able to afford insulin. So we can drive down those costs by taking on the pharmaceutical companies and expand coverage, and that's what I'll do.
Thank you.
Thank you.